for all the blessings that you are giving us, Lord. One of the blessings is these natural remedies. You have created all these plants that have healing powers. And I pray that you will be with us, you will teach us. Help me to hide behind Jesus, Lord, and let Jesus speak and teach us, Lord, the ways that we could be like you. Yeah, preaching, healing, teaching. We need to all become medical missionary workers. And this is the first step, Lord, here. I pray in Jesus' name. Amen. So this is what Sister White said. The time has come when every member of the Seventh-day Adventist Church should be a medical missionary worker. That involves a lot of education, and that involves hands-on. So I don't know about you, but I am a guy who likes hands-on practice. This is why I work in emergency department for 10 years, and I love doing all the stuff, but little I realized that a lot of interventions that they do in the hospital, they are very invasive, and they are harming patients more than helping them. And when God has shifted my gears, and I got to a place where there was a crossroad, and the Lord told me, you're no longer gonna be a family doctor or emergency doctor or whatever. You need to learn the natural ways, because as I mentioned this morning in the sermon, there are many ways to practice the healing art, but it's only one way that heaven approves, and that is not hospitals. It's not surgeries. It's not, whatever. It is natural healing. And if we practice natural healing, we can avoid a lot of surgeries, by the way. I can give you a simple example. I have patients in my practice that they had acute cholecystitis, which is an inflammation of their gallbladder, because she had biliary stones, gallstones. And her only option in a hospital would be surgery. And so, because she loves the health message and she knows there's a better way, we have to remember surgery is not the only way, or the allopathic medicine or the modern medicine, or I like to call it Babylonian medicine, it's not the way for the children of God. It's just not. And so she came and saw me, and I said, okay, let's do something. Let's follow the 8 laws of health. And she's like, yeah, I kind of heard of it, but so I said, okay. So we needed to do a lot of education. And then I said, I'm going to change your diet. Oh, I don't know how that's going to work. I said, well, do you want to get well or not? And we all have to come to this point where we have to make a decision. And that decision involves sacrifice. So if you want to follow the Lord without sacrifice, forget it. There's no such thing. And you are making a sacrifice right now. You could go somewhere else, be with your family, but you are taking time to learn this, and the Lord will bless your efforts, right? So what I wanted to start with is, this is practical application, and I just gave you in the handout, and I'm going to invite you to turn with me, from the first to the second page, and you will see these are a few herbs that are actually available in this province. I purposely put them there, and it's not the purpose of this, workshop, but you need to learn how to recognize these plants. We all do, right? Because the time will come where you'll no longer be able to go and buy or sell. We know that, right? And so that means you cannot go to a food health store to buy herbs. You're going to have to go in the woods and recognize them. And so this is our training. God is teaching us. Sometimes, some of us, we might have to run in the woods and live in the woods for a while until the Lord will actually gather us together and we're going to be delivered. So this is the training. Consider it a training to become 144,000. Who wants to be part of 144,000? Why? Oh. She was not paying attention. Okay. I'm going to ask again. Who wants to be part of 144,000? Okay, now the question is, why? Why do you want to go through the big tribulation? It is because you're not going to see death. You're going to suffer a lot. mentally, physically, emotionally. You're not going to die, but you're going to go through a lot of suffering. And God is teaching us how to alleviate this suffering, whether it's for us or it's for others. And this sick, it's about to become, this world, it's about to become extremely sick. And people are going to start dying right, left, right, and center, so to speak, including doctors and nurses. Okay? So, this is also not part of this workshop, but let's just say that the job that they have done for the entire world was poorly researched and a very bad way to do it. And because they did not research it properly, now a lot of people are dying from it because this is causing a lot of inflammation. The good news is God has provided for that too. He did provide for that too. So there are a lot of herbs that have the necessary active constituents or natural chemicals that can destroy, can literally liquefy and melt the spike protein. And some of these herbs are actually very readily available, even in PI, right? So, so here's the thing. A lot of people, I get more and more people that are injured by this, and it's unfortunate because it was a very big medical error, and now there are a lot of people are trying to figure out what to do because they have a lot of inflammation, a lot of pain, chronic pain. So what do we do? And not only that, their microbiome immunity has suffered, and they get a lot of infections. So some of the teas they're going to learn today, you can treat an infection, whether it's a bladder infection or a lung infection or any kind of infection with ease. And you don't need to have anything sophisticated, right? So I'm going to go through these herbs. So the first one is St. John's wort. Anybody knows how St. John's wort looks like? It's a yellow flower. It's like has 5 petals. And the way to recognize it is when you crush it, there's a red juice coming out of it. No? Red, purple, yeah. But anyway, you can Google up and see, but I invite you to go in the woods. Now, it's spring. It's one of the best time to actually harvest stinging nettle. Have you heard about stinging nettle? Yeah? Okay. Stinging nettle, it's an amazing plant. People are just like, oh, this is a weed, get rid of it. No. The same thing with dandelion. It's not a weed, it's a healing plant. Every single plant that was put out there, it has a healing power. God did not make anything to be danger for us, but we need to have the knowledge how to use it. We're going to learn in this workshop that some of the plants are really dangerous because people do not know how to use it. And we have to remember the difference between a remedy and a drug is made by the dosage. Are you following me? Okay, so the difference that makes a remedy safe and the same remedy a poison is the dosage. So you have to be very careful. The dosage is everything. This is why the medical community and the research community, they have come with terms as lethal dose or the minimal lethal dose. What is the smallest amount of this plant or this drug that can kill? But also there's it's the treatable dose or the minimal amount of this substance that can treat without causing harm. So that's applicable even to plants, right? The first drugs that they were made, actually they were taken out of plants. Even today, there is something, I'm going to give you a very simple example. There's a plant that's called periwinkle. Have you heard about it? Periwinkle. Okay, in Latin, that periwinkle is actually vinca minor or major. The scientists, they extracted the substance in it and they made the vincristine, which is a chemotherapeutic agent. It kills cancer cells. So this is how powerful the plants are. And this is just a simple example. There's you've heard about Dr. Fleming and the penicillin, right? So again, it was an accident, but virtually everything that was developed, in the initial steps or in the initial years of, pharmaceutical companies, they have taken stuff from nature and then they started developing and they started synthesizing artificial stuff. Excuse me. So, one of the 8 laws of health, water. See, I cannot even talk without water. Okay, so St. John's wort. This is one of the best antiviral. Did you know that? And we're talking about strong viruses today, whether it's COVID, whether it's flu virus, whether it's hepatitis virus, whether it's rhinoviruses, coronavirus, whatever virus is out there. One of the best plants, antiviral, is St. John's wort. But there's always a catch with this. A lot of these good plants are metabolized by the liver, okay? And you have to know that everything that you put in your mouth has to go through the liver passage. Why? Because the liver is the big chemical plant of your body. And everything that goes in your mouth, your body has to decide whether it is safe for consumption or poisonous. And that happens in the liver. The liver has the property of changing chemical structure of anything that you put in your mouth. Anything that you actually manufacture in your body, including hormones, vitamins, any substances that are used by the body to activate the immune system. Anything goes into the liver and gets activated through a process that's called methylation. Okay? Anyway, I don't want to get into like biochemistry 101, but everything goes through the liver, including these plants. When you make a tea or a decoction or a tincture or what have you, it has to go through the liver. And because it goes through the liver, you have to know the properties of that plant. So my first lesson to you guys is, yes, you recognize the plant. You have to make sure what you put in your body, it's what you think it is. Okay, that's rule number 1. Safety, right? So the father of medicine, Hippocrates, he said, primum non nocere, which means first do not harm, right? If you're not sure that that plant is St. John's wort, do not harvest it, do not make tea of it, and especially do not drink it. Because that can be something poisonous, they have no idea, and can put you into a liver failure or kidney failure, who knows. So that's my first lesson. Absolutely, you have to be 100% sure what you harvest is the plant that you think it is, okay? Lesson number 2, when you use these plants, you have to make sure that you know the dosage, appropriate dosage. And we are here to learn about the appropriate dosage, and the dosage for for these teas are different. So, and I started talking about, if we jump to page 3, I think. I did not number the pages, but it says types of tea. I'm going to jump in types of tea a little bit to explain that there are 3 different kinds of tea. There is the ceremonial tea, this the culinary tea, or the common tea that everybody drinks tea, right? Whatever you drink chamomile, you want to feel good. You have friends, you want to have tea, or you are British and you have the tea at 5 o'clock. That's just the culinary tea, right? And there is the ceremonial tea, which is coming from usually countries like Japan, China, Morocco, even Ukraine. They have that UK. They have the ceremonial tea. The biggest is Japan, and there's a difference between, and then therapeutical tea. The difference between these tea is that the quality of ingredients are markedly different. The tea that you find on the shelf, which is a common tea or culinary tea, may or may not be organic, may or may not be high quality. Usually it isn't, because they are trying to make it affordable. So you can have a taste of, let's say, Moroccan tea, or you can try to have a taste of whatever, black tea, or, I don't recommend black tea, but anyway, if you want to have, for instance, some lavender tea or some chamomile tea, German chamomile tea, they don't always take the best of the best. In order to have that, they usually make them more expensive, and that gets into the realm of ceremonial tea. The ceremonial tea is one where usually it's a spiritual journey, so that has a different connotation. The ceremonial tea is not for healing, it's for a spiritual journey. That's big difference. Okay, and then they have a certain ways to do it, and when they harvest that plant, it's usually the first crop and is the best of the best. That's why they are the most expensive tea that you can get, right? But that's ceremonial tea. It's just it's a very cultural thing that's passed from generation to generation. And yes, you have green tea, for instance. It can be ceremonial, high quality. Yes, it has therapeutic teas, but the way they make it ceremonially, it's not therapeutic. Are you following me? Yeah. So they just enjoy the taste, but they were doing it. They have a special technique, and they're kind of get you into a spiritual journey, so to speak. Therapeutic tea, on the other hand, is using always organic remedies, because you cannot cure anything if the tea is contaminated. Are you following me? It's actually, it beats all the purpose of therapeutic tea if your tea is not organic. It has to be clean, first of all. Secondly, when you use the therapeutic tea, it has to be good quality. You have to get the proper amount, and you have to steep it or whatever, boil it for a certain amount of time. Depends on what kind of ingredients that tea has in it. Okay? So for instance, St. John's wort, right? Also, we have to know which part of that plant has therapeutic benefits. There are plants that you can use everything. For instance, right now it's spring, and you decide to go and get some stinging nettle. You can use the leaves, and you can use the root. Or you want to get some burdock. You can use, again, the floral part, or you can use the root. Or dandelion, you can use the flowers and leaves, and you can use the root. They have different properties. So that's why I said, know your stuff. You have to know what you want to do with it, right? If, for instance, I want to, enhance bowel movement, and I have a case of constipation, and, I want to help the bowel movement, and I can use burdock tea, for instance. I have to know that the root of burdock actually has, that active constituents that will help me to facilitate the bowel movements. If I use another part of the plant, it's not going to have the same effect, right? So that's why I said education and knowledge is paramount. You have to know what you want to do. And so with St. John's wort, you want to use the tops of the flower of the plant, or the flowers, right? So you use that. And what is this good for? It's actually good for diarrhea. So if you want to use it for constipation, is that going to help you? It's going to make you more constipated. You see how important it is to know the plant? Because you can make things worse, right? And it's good antiviral, it's antibacterial, anti-inflammatory. It's good for insomnia. But what the science has discovered is that St. John's wort is one of the best antidepressant remedy out there. It's equal in power with SSRIs, selective serotonin inhibitors, like paroxetine or fluoxetine, without any side effects. Isn't that wonderful? They're powerful. But you have to know some of the plants, and St. John's wort is one of them. It changes the way the liver handles drugs. It acts on a enzymatic system in the liver. As I mentioned, the liver has to transform everything. It acts on the liver, and it changes the way your body handles drugs. Therefore, this is contraindicated. Okay, so maybe I should have written there, but you can write it down there. You cannot have St. John's wort tea if you are taking medication. You have to know that you cannot, because what this is going to do, it's going to enhance the liver capacity to eliminate that medication from your system. It's a cytochrome C450 enhancer. Cytochrome C450, it's a protein or enzymatic protein in your liver that it's taking any substance that gets into your bloodstream and transform it chemically. Okay, this is how our body works. Even if, for instance, we have estrogen, women's, right, and men. All of us have estrogen, progesterone, and testosterone, all that's hormones, or we have thyroid hormones, or we have adrenaline or adrenaline. Those hormones are secreted by our organs, in an inactive form, because otherwise they would start act within the organ that makes them. Isn't God amazing? Right? So, for instance, you have insulin that your pancreas makes. Insulin is actually secreted in an inactive form. If that wouldn't be so, then the pancreas would dissolve itself. Isn't that making sense? So God, in His knowledge, He made a human body, and He made all these organs to secrete all these hormones or all these enzymes to help us digest food, but they're all in inactive form. So what happens? They have to go through the liver passage. So the liver activates them. And how that happens, it changes their chemical structure. I mean, we are fearfully and wonderfully made. We have a chemical plant which is called liver. This is why a lot of people get liver disease when they get a lot of drugs, or they get, drug addicts, or they overdose. It has to go through the liver. That's how we are made. And the liver gets the full brunt of it, because it changes the chemical structure. When it changes the chemical structure, some of the substances become very toxic, and the liver takes all the brunt and it's affected, right? So again, St. John, you cannot make this tea if you are on medication. You have to see a doctor or a naturopathic doctor. They know how to handle that, right? Warning, okay? But if you're not taking any medication, this is one of the best antidepressant and anxiolytics, so anti-anxiety plants. Very effective. It does not have any side effects, right? And it's very pleasant. Now, if you have bladder problems, respiratory problems, right? A lot of these plants have antibiotic and natural antibiotic properties. And the beauty of it is that your body, your gut, and your good bacteria is not going to be affected most of the time. It depends on the dose and the length of the treatment, but most of the time it's not going to be affected. You're not going to have side effects. Okay? So it's that, you can treat PMS syndromes, menopause. A lot of these teas have endocrine modulator effects, which means they rebalance your hormones. If it's too high, it's going to bring it back to normal. If it's too low, it's going to bring it up to normal. There is no drug in this world that I know of that can do that. But the plants do that. A lot of them. Yes?
How much and how often?
The tea? So you see the dose here on the page. Where's the page? Page 3? Page 4, sorry. It says therapeutic tea, page 4, top of the page. So the dosage is usually half teaspoon or to 1 teaspoon per cup. And usually you have 2 to 3 cups a day. And as I mentioned this morning in the sermon, do not expect to be, let's say, depends on the herb. Yeah. Do not expect to regulate your hormones in a day or two.
Right.
It's going to take usually 2 to 3 cycles. Okay, so you have to have patience. However, there are certain plants like sleeperly herb. Have you heard about sleeperly herb? Okay, or aloe vera, or marshmallow. They have something that's called allantoin. That is, it's like a gel-like structure that actually heals our gut, top to bottom. It's very healing. And you can feel the effect within a half an hour from taking the tea. It's immediate. Very powerful, and it's very soothing for your gut. Okay? Slippery elm or marshmallow root. So slippery elm bark. There's so many teas. I mean, I would love to have a lot of time to talk. There's so many, remedies that God has made for us. And people are dying because of the lack of knowledge. It's so sad, right? So, another tea, it's, rhododendron, Labrador tea. I don't know, anybody knows this? This is native to PEI. So all these herbs that I put here, just a few of them, they're all native to PEI. You find them here. Okay, Labrador tea. So it says easily identify thick leaves with unrolled edges and dense fuzz underneath. Rhododendron. And see where you find them. So it's a good remedy for respiratory illness. If you have asthma, if you have chronic bronchitis, if you have pneumonia, if you have whatever, flu, and you have a cough, make a tea out of this, and the cough is going to be relieved really quickly, right? Pardon? For allergies? No, for allergies there are other things. You know what rosemary is, right? A lot of people use rosemary as a spice, right, or as a herb. Rosemary is one of the best things to use for allergies because it balances the immune system. There has to be a very delicate balance between T helper, which is an immune cell, T helper 1, T helper 2. If you have too much of one, you have allergies. You have too much of the other, you have autoimmunity. So rosemary has the properties of balancing this. I actually treated severe chemical allergies and sensitivity, a patient in St. John, and he responded very well. He could not go to the doctor's office. He would fall down and have seizures because of the smell of chemicals. Or if he would shake hand to someone who was wearing cologne or any spray, body spray or anything, he would fall down and have a seizure. And it was so bad that after the pandemic, if he would shake hand to someone who was vaccinated, he would have a seizure. So, and the doctor was so exasperated. His family doctor said, go see a naturopath. Go see a naturopath. I don't know what to do with you. And I don't know how he heard about me. And I said, sure, let's do this. And first of it, I started him on a detox protocol and on fasting protocol. And it's something very easy that anybody can do. You can take melon or watermelon, and you do a watermelon fast for a week. At the end of the week, I get a call, and this man was just like, Dr. Boldi, this is just amazing. I have never felt so good in my entire life. I feel a different man. And every time I have some problem, I do this, and I take the tea you recommended. One of the tea is rosemary. The other one is exactly the plant that I talked about, which is stinging nettle. Stinging nettle also balances the immune system. It's very good for allergies. Okay. Another thing is reishi mushrooms. Very good to balance the immune system. Treat autoimmunity. It's very strong anti-inflammatory. And virtually every plant, turmeric's also, every plant that has anti-inflammatory properties, you have to know that they are cooling down the immune system, they're balancing the immune system. Autoimmunity and allergy, it's an over-response to an allergen, and that allergen can be a drug, a chemical substance, a food, whatever food, or whatever dish you had, or even a bug in your body, right? And your body's trying to push or fight that, but the response, it's overreaching, it's too much. And now you start having these symptoms, right? You like watery eyes and scratching nose and throat and sneezing and even a skin rash and all that. So that's a sign that your body is overreacting, your immune system is not balanced, and your liver is struggling to restore the balance. Okay? If you have any skin disease, your gut and your liver is the problem. You have to balance the gut and you have to treat the liver. The liver can be poisoned. And your body knows one thing and one thing for sure. It has to get rid of this, chemicals or poison as soon as possible. And there are 4 ways of detoxification or elimination. of the human body, right? There's breathing, urinating, defecating, okay, and sweating. These are 4 ways the body detoxifies. So imagine that you have problems with your kidneys, so urination not working well. You're constipated, which most of the people are. Defecating, so your body cannot eliminate, toxins very well. You're breathing because you have troubles breathing because maybe you have asthma, or you just run a flu or something, and there's inflammation in your lung. So the only way your body can detoxify in liver in this case is sweating. So all the poison goes through your sweating pores, right out, and when it gets onto your skin, the skin gets irritated and you have the rash. So you go to the doctor. What does the doctor say? Oh, let's give you some cortisone cream. So by doing that, you literally take a hammer and smack the immune system in the head, and you tell them, hush there, keep quiet, stop complaining. Where in fact your body is trying to do something natural, it's trying to get rid of these toxins. Right? To see how important it is to know how the body reacts. Right? That's why we need to know our bodies. Okay, so goldenrod, wonderful plant. It's everywhere across Canada you can find goldenrod. It's very good in treating urinary bladder infection. Bladder infections. You can treat lung infections. It's a demulcent for your stomach. If you have some problems with your stomach, you can add it. You can make a combination with aloe vera, with sleeper elm or marshmallow root, with chamomile. They're very good in treating that, right? And it says it's diuretic and tonic. Now, it's very interesting. You all heard about diuretics, right? You go to the hospital and maybe you have high blood pressure, and the simplest drug that a doctor can give you is furosemide or Lasix. It's a diuretic. Oh, your pressure's high. Let's bring it down. Take this drug. What happens with these diuretics? You get rid of the water, but also they get rid of the electrolytes. You lose sodium and potassium and magnesium, and you need them. These plants, which are diuretic, they're not actually diuretic. They're called aquaretic. They get rid of the extra amount of water, but you keep the minerals in your body. That's huge difference, because sometimes it's hard for you to absorb minerals. You absorb minerals from food and some of the minerals from the water, but you need minerals. Not virtually, it's actually the case. Every single chemical that happens in your body right now, chemical reaction, needs minerals. Every one of them. And I'll give you a simple example. Magnesium, it's a very important mineral. Calcium, magnesium are the most important minerals. Magnesium is needed in over 200 chemical reactions that happens every nanosecond. If you don't have enough magnesium, that reaction does not take place. And it's a chain reaction. That reaction might be in a cycle of reactions, and that can be a rate-limited reaction. I don't know if you understand what I'm talking about. A rate-limited reaction, it means if that reaction does not take place, the entire cycle stops. So you're not going to have hormones created. You're not going to have energy from food. You're not going to have, pain stimulants, or you're not going to have this, or not going to have that. So it is very important for us to have minerals. This is why people are getting sicker and sicker, because the soil, because of the agricultural practices, they put a lot of pesticides, they get depleted of these minerals, and the plants will only get from the soil what is available in the soil. Are you following me? So if the soil is depleted, the plant will be depleted. And guess what? If there's a mineral depletion in that plant, the bugs will going to come and eat it. And people are saying, oh, bugs are bad. Let's destroy them. Let's put more pesticides. But actually that was made by God in such a way that that plant that it's lacking minerals, God will destroy it because it's going to harm you. This is why the bugs are coming and destroying that plant. And people, what are they doing? Oh, we have to destroy the pesticides. They ignore the ecosystem. They ignore the way nature works, right? So we need to know how the plants are, how to have healthy plants, how to have healthy soils. So, another tip is when you harvest these plants, please do not go by the wayside, by the roads and by the highways to collect that. They're going to be the most, contaminated plants you'll ever get. Try to go in a place, in the woods or in a meadow where you know there's no contamination, because you're not doing yourself any favor if you collect a plant that has been contaminated by exhaust gases from the car, right? So, another plant, common mullein. Oh, I love this plant, Verbascum tapsum. One of the best plants if you have irritating cough. And, sometimes, our children can get croup. It's a heartbreaking thing to see that how you feel like their chest is going to explode. And they cough, and they cannot sleep. This plant, if you make a tea out of it, it can calm them right down and they can sleep, and, they can get rid of those secretions very easily. It has very good anti-inflammatory effect, right? Very good in asthma. And look at that, it's anti-inflammatory, right? So it's potentially good in all these immune problems, right? Now, so I talked about types of tea: ceremonial tea, culinary tea, therapeutic tea. So we're going to jump over that. And as I said, I wrote there in capitals, when you harvest, be sure, do not guess. Do not guess. Be sure that what you harvest is the one you want, right? Mental benefits, all that. So, okay, so let's see. I wonder if we can get maybe a small cup or container or something.
Yeah,
just
hot water.
Just to demonstrate how we do that. So, cedar. Okay. Love it. One of the best treatment for cough and lung infections. As a matter of fact, Sister White recommended in the summer, when you smell the sap, go in the woods, the fir, the spruce, the cedar, they are having healing properties just by smelling that sap. It heals and regenerates your lungs, right? God has made that. And it's made for your benefit and mine. So it's very easy. Just cut them down like this. Okay? So remember, it's about 1 teaspoon per cup, right? 1 teaspoon per cup. And if you want to combine them, you can put pine, you can put anything else to combine to have multiple therapeutic effects. Naturopathic doctors, herbalists, they usually combine the herbs. And, in time you learn how to associate herbs. Some herbs are, they go together, they're sisters, right? For instance, if you want to do St. John's wort for anti-anxiety and anti-depression, properties, you can combine St. John's wort, you can combine lemon balm, you can combine chamomile. They all have nervine or nerve calming effect. People who are anxious all the time, right? Or nervous all the time. If you have to go for an exam, students, right? If you have to go for an exam, same thing. You can get some chamomile, some lemon balm, some of these herbs that can calm you right down so you can focus. There are other herbs like ashwagandha, for instance, that can enhance your memory. Oh, by the way, rosemary. It's one of the best herbs to enhance memory. Did you know that? When you smell this rosemary, they have done studies. The smell goes directly into the rhinoencephalus, which is the brain for the smell, and gets directly into your brain within seconds, so probably 4 to 5 seconds. And it can enhance your memory and attention span and focus.
So essential oil would be good.
Essential oil, yes. Essential oil, right? So, you go for an exam, get some rosemary essential oil, you're going to be smarter. It does make you smarter. It does, because it helps your memory. It helps your memory. So, memory, it's a very tricky thing. There's a molecule of memory in the brain, but that molecule is used for other things as well. And what this does, it's actually help you focus and brings back where people have an issue is recollection of the information. They might not have a problem, studying and memorizing, but it takes them time to bring back to memory what they have studied. So that is recollection. So this rosemary is actually enhancing the speed, and it's increasing the speed the way you recollect and you remember things, which is desirable during an exam. That's what you want, right? Because you have only limited amount of time, right? So, so you put this one, again, cedar, hot tea, okay? Now, here's the difference between therapeutic tea and decoction. Therapeutic tea, boiling water, put on the top of the dry herb or fresh herb, yeah, and it's an infusion. And leave it there for 15, 20, I sometimes even say 30 minutes. In this case, I will leave it longer. Why? Because, this is more like a woody kind of a leaves, and it has a lot of aromatic herbs. So the more it stays in the hot water, the more aromatic substances, oils. The more it stays in this hot water, the more extraction it happens, right? Now, you have to know there's a difference between therapeutic tea and decoction. And what's the difference? The difference is that usually for therapeutic tea, you use the tops of the flower, of the plant, flowers and leaves. When you want to make a decoction is when you have to use something like bark or root or some of the fruits that are really woody fruits. Okay, that requires boiling for more than just 15-20 minutes. So you cannot extract active constituents through infusion. You have to boil that stuff. So what they usually recommend, how you do a decoction. Usually you have a crock pot. It's the easiest way. You throw all your roots inside, and you put it simmering at low temperature overnight. And in the morning, you have a very concentrated tea that's very therapeutic. And you drink that, 2 or 3 cups a day. And it's much more powerful than tea, by the way. It takes longer, but it's much more powerful. Now, there's something that my family and I enjoy very much. It's called change of season soup. Maybe I should have put that in. That's a combination of roots and mushrooms. And we do that because all these roots are enhancing the immune system, and they are protecting us from getting sick, or when you get sick, you have a mild form of the disease, right? Did you say something? No. Okay. So that's do you understand what's the difference between tea and decoction? That's the difference. So when you want to treat something that is really deep in your body, like chronic disease, like let's say osteoarthritis, or you want to treat something like chronic diabetes, it's good to make a decoction. It's much better than a tea. Now, when you want to, for instance, to treat something very quickly, like a spike of your blood pressure, you have a hypertensive crisis, you need something quickly, you make a tea. You don't have time for decoction, right? Because if you have high blood pressure, you wake up when your blood pressure is 180 over 100 in the morning, then you have a terrible headache, right? And if that's the worst headache of your life, I would actually recommend you call a doctor, because you might be bleeding in your brain. Okay, so that's not safe. But let's say you have just a mild headache, and you check your blood pressure and say, oh wow, it's 180 over 100. It's like I'm going to blow a gasket. I have to do something, right? And you don't have time for decoction. So the simple, remedy is take hibiscus tea, which is a hypotensive tea, and you can combine it with stinging nettle tea, which also drops the blood pressure, right? And make a tea. If you have, for instance, lily of the valley. Do you know lily of the valley plant? Lily of the valley. It's a beautiful flower. Has a fragrance. It's like amazing fragrance. And they look like little white bells. Okay, and they have long lanceolate-like leaves, green leaves. So a lot of people are growing them, in front of their garden, in front of their house. They have a little garden with the lily of the valleys because they look nice and they smell beautiful, right? That is one of the most powerful plants that can drop your blood pressure and can slow down your heart rate if you have atrial fibrillation. If you have palpitations, so you know what's going on, that can slow down your heart to back to normal, right? So, combine this tea and make an infusion and start drinking it. Some people respond from like 2 cups of tea and their blood pressure comes right down, like in the same day or the next day, right? Decoction is more for condition like chronic condition. You fight chronic inflammation, chronic pain. That's usually what is the case. Or you want to boost your immune system because your immune system has been very low. You might have taken chemotherapy and your immunity is in the boots, or you might have gone through a lot of antibiotic therapy and your immunity again is low and your microbiome is like almost destroyed, right? So you can use decoction for that, and it's much stronger, and you can take it for a period of days, usually a week, and it can help you a lot, right? For instance, yes. Depends on the age of the children, and depends what what kind of condition the children have. What do you want to treat? There are certain things that are very safe for children. Chamomile, it's always safe. You can use chamomile for colics. It's very good. It calms down the child. You can help him sleep, and it literally has anti-inflammatory effect on the gut. Right? It can also help with constipation. A lot of children nowadays are fighting constipation, and they don't drink water, and they are given Tylenol, Advil, and all that, and that can further complicate the constipation. And so simple teas, simple remedies like this can help them big time, right? So. Okay, there you have it. So that's the infusion, that's the decoction. Now, decoction here, for instance, this is bark, right? So let's see who's paying attention. How do I prepare this? It's bark, exactly, right? When you have bark, you need to make a decoction. If you try to make a tea, it may or may not work, but sometimes if you have a bark, it depends on the bark. But the root will not work, for sure, because it's not enough time in 20-30 minutes just by infusing it to extract all the active constituents. It has to stay there a long time. Now, I'm not going to talk anything about tincture, but you can make tincture at your home, but it's more complicated and it involves alcohol, and you have to know how to deal with that. The ratios are 1 to 5, sometimes the ratio is 1 to 2, and you have to know certain plants or certain bushes like frankincense, for instance. Have you heard about frankincense? Yeah. Frankincense is one of the miracle remedies. Why? It can cure a lot of tumors. It can cure skin conditions. It can cure inflammation in your gut, in your lung, everywhere. It has very strong anti-inflammatory properties, and you can use it or arthritis. You can use it in lung disease. You can use it in liver disease. You can use it even as adjuvant in cancer sometimes. You can use it in so many things. But because it's a resin, you need 90% alcohol to extract the active constituents out of that frankincense. And you have to know how to deal with that. 90% alcohol is very flammable. You can blow your house if you don't know what you're doing. You're going to blow up, right? Be very flammable. Yes?
Where does frankincense come from?
Most of the time comes from India or that Middle East area. Yes. Yes, go ahead.
Can you use frankincense essential oil?
You can, but again, I did not talk about essential oil because it's not my preferred way to treat. You can, but you have to be careful. We have to understand that essential oils are extremely potent. It's the same constituent, but magnified by 1,000. And you can burn your skin, you can burn your gut with that. So always try to use, if you can, if you use it very small amounts. Or the better yet, you can actually dilute it with a carrier oil, like avocado oil or grapeseed oil or almond oil, right? An oil that is very light, not thick, very light. Okay. Another thing that you can do with oil, I did not talk about it, but you can actually do inhalations or nebulizers with them. Actually, I've used that, and I use that with my patients. Peppermint, eucalyptus. Oh, eucalyptus. I love eucalyptus. Unfortunately, we don't grow here eucalyptus. I would love to have that. Eucalyptus is one of the best remedy for muscle and tendon injuries and diseases because it takes the inflammation away and it actually heals and regenerates tendons and basically heals any injury. If you have, for instance, like a shoulder injury, it's very common after a certain age. You can have, for instance, rotator cuff injury, very painful. You try to lift something up and you didn't do it rightly, and your shoulder kind of goes sideways and you injured one of the tendons and muscle. The reason why they take so long to heal is because the tendons are fibers that are stretching under extreme conditions, and God in His knowledge did not put blood vessels in those tendons, because if He would, when they stretch over a bony prominence, they will burst all those vessels and you would bleed. So the way actually they heal is just by enhancing that, like bursae or synovial fluid. All the tendons and ligaments that are found around the joints are fed by something that's called synovial fluid. That synovial fluid is very oily substance which basically lubricates that joint, right? Think of a car that you need to lubricate the cylinder in the engine. If there's no oil, that's going to seize within seconds. Mm-hmm. So God has done this. So He created a bursa, which it's basically a type of tissue that secretes this synovial fluid. And that synovial fluid is rich in minerals and vitamins and good nutrients. And that's the only way you can heal that tendon. So when you apply this eucalyptus oil, it penetrates your skin and gets directly into your tendon and has very good healing properties. As a matter of fact, a few years ago, what was that? Probably back in 2019, 2020? When did I broke my foot? I broke my foot, yeah. 2020. So what happened, I was on our new property, it was winter, 3 feet of snow. I did not see, there were a lot of stumps underneath the snow. And I tripped. I was doing some work and I tripped, and actually I fell and I twisted my foot and I broke it. It was not a good experience, but I knew I broke it because I used to put cast on this kind of breakages in emergency department. I said, I'm not going to emergency. I don't want to get vaccinated. I don't want to get sick from there, other viruses or whatever. And I said, I'm going to fix myself. And what I did, I used a combination of eucalyptus and frankincense, and I massaged my foot. It was painful at the beginning, but it got better by the day. And I massaged my foot, and it was cured in, I don't know, a month. With no cast. With no cast. I could not walk on it, but I massaged it, and I tried to. I did not. The good thing with foot is you don't have to really reposition because there's a lot of tendons, a lot of muscles, and it was not a displaced fracture. I would not recommend that. For instance, if you have a forearm or a femur fracture or something else, you have an open fracture. It's an entirely different story, right? And anyway, I'm a physician and I can fix myself. But here's the thing. To that point, I knew that the only way to fix it is to put a cast. And I said, I'm not going to do that because I have to go to the hospital. So I said, I'm going to give it a try to this eucalyptus. And I was amazed. Wow. Because when I started doing the massage, within a few days, the pain was gone, the swelling was gone, And, I had sensitivity for, a month or two after that. And even after a year, I was a bit, but now I'm fine. And if, essential oil, yes. Eucalyptus. So I combine them 1-to-1, and I faithfully massage it 2 times a day, and also hydrotherapy. Hydrotherapy, it's gold. I was able to heal my, there's another story. I was able to heal my shoulder. I was unloading something very heavy. Again, that was 300 something pounds, right? And, we had a ramp, and it kind of fell off the ramp, and I tried to protect it, otherwise with the damage. So, of course, I had a rotator cuff injury. So, at that time, I was still a student in CCMM. And I went to my professor, who is, an expert. He's a doctor of traditional Chinese medicine and a herbalist. And he said, okay, let's do acupuncture. Oh, boy. So they did acupuncture. Nothing helped. Nothing. I tried to take all the supplements that I was learning there. Nothing helped. I did not know much about herbs. And then when I learned about herbs, I tried to take herbs. Nothing helped. Nothing. And I said, what is this? I was really disconcerted and discouraged. It's like, this natural medicine is supposed to help. And then the Lord is reminding me, hey, have you forgot about water? I said, yeah, I drink water. No, water, hydrotherapy. I said, okay. So then I started doing hydrotherapy on my shoulder 2 times a day, morning and evening, within a month. So I was suffering for like more than a year, almost 2 years. Chronic pain. I was disabled, literally. I could not do much. Pain during the night, could not sleep. I started doing hydrotherapy faithfully 2 times a day. Within a month, gone.
Wow.
Gone within a month.
Incredible.
So the water is very healing internally and externally. And the water is part of the 8 laws of health, right?
Let me just ask a quick question
Yeah.
again. Would eucalyptus and frankincense be good for tendons, elbow, as well?
Oh yeah, absolutely. For any tendinitis or any injuries or any elbow, any knees. There are people who are suffering terribly with their knees. They have osteoarthritis in their knees or hip or anywhere where it involves bone, tendons, muscles. A lot of people are suffering with IT band, iliotibial band, terribly, right? And nothing helps because that's a tendon, and it takes sometimes months to heal because there's no vessels to bring nutrients, to bring oxygen. It's fed by that viscous liquid, which is synovial fluid. But if you use eucalyptus oil or frankincense oil, all these essential oils, they penetrate the skin, and this tendon, most of the tendons are very close to the surface, to the skin. So that's the benefit of these oils. They penetrate the skin very quickly because they're oily substances. So you have to know something. This is why a lot of pesticides are so dangerous, because all of them are oily substances, and they absorb in your body quickly that you can say 1 and 2.
Wow.
Okay, and you cannot take them out of your body very easily. Because they actually dissolve in the fat of your body, and they can stay there for decades. So oil is very easily absorbable, okay? Water is absorbable too, but oil especially when it comes about drugs and pesticides and chemicals, right? So this is one of the reasons why these essential oils are working so well and they are so efficient, because they're oily substance and they carry these active constituents and get directly into the tendon. Whereas, when you would take it by mouth, it would not get there, right? Castor oil is more for, I like to use castor oil to actually dissolve tumors and bony prominences, calcifications or whatnot, and detoxify. It is good anti-inflammatories, but when it comes about tendons and muscles, nothing beats eucalyptus, nothing.
What about the carpal tunnel syndrome? Do they have also?
Carpal what?
Carpal tunnel syndrome.
Oh, carpal tunnel syndrome. Yeah, well, what is the carpal tunnel syndrome? Is it ligaments?
Yeah, I think so.
Well, there you go. Yes. Eucalyptus. Yes, everything.
Because I'm a victim of that.
Yes. Yeah.
Explain how to make, maybe that because it does not know
What?
how to make hot and cold showers, how many minutes
Okay, yeah, so I don't know if I explained that here. Okay, let me go. So, okay, there's one thing before we go to poultices, because we want to make a poultice and we're going to talk about hydrotherapy as well. One thing I want you to understand, there are certain plants out there, they can harm you. They can actually kill you. They can be beneficial, but you have to have extensive knowledge about this. One of them, for instance, monkhood, right? So we are at the page with decoction. At the bottom of the page, it says therapeutic teas that you should never make. Why? Because you have to have extensive knowledge and experience in using these herbs. I know herbalists and naturopathic doctors with experience that are really careful, and they prefer not to use aconite, which is monkhood, because they're so poisonous. And why they're poisonous? Because the difference, remember when we talked about the therapeutic dosage and the lethal dosage. Remember that? So the therapeutic dosage is the smallest dosage where this plant or this constituents, right, has a therapeutic effect. That therapeutic dose is very close to the lethal dose. And if you make a little mistake, you can go into liver failure and die. You cannot play with. There's no playing around with this, right? People have died. So, by the way, one of the plants that I would advise you to stay away from internal usage is comfrey. Comfrey, it's an amazing plant. Comfrey, it's an amazing plant. You can use it to help you with broken bones, to help you with detoxification, to help you with skin conditions. But taken internally, it has something that's called pyrrolizidine alkaloids. Have you heard about alkaloids? So if you read this, you can read this at your leisure at home. Look at all this, deadly nightshades. What makes it, so powerful and dangerous? Alkaloids. There's a special natural substances. They're called alkaloids. They're very poisonous.
What if you did it once?
Once it's okay, but if you do it consistently, remember that. So, as a matter of fact, I have to tell you that in Canada, the internal usage of comfrey, it's illegal. It's banned.
Because I had tea last week, but I will never.
Well, I do not recommend you, because it can put you into a liver failure. It has this pyrrolizidine alkaloids that can put you into liver failure. Remember I told you about liver? Everything that goes into your mouth, gets into your stomach, gets absorbed into your bloodstream, and has to go to the liver. There's no way around it. So when it goes to the liver is trying to decide, is this good thing or a bad thing? So let's find out. So it's going to start changing the structure, the chemical structure. And there's a series of chemical reaction that takes place in the liver. It's the hydrolyzation and phosphorylation and methylation and all that. So through these chemicals, there are hydroxyl groups or methyl groups or carboxyl groups, or whoever knows chemistry, they probably know what I'm talking about. But the bottom line is the liver is trying to change the chemical composition to make it active and to decide whether this is safe or it's friend or foe. It's safe or unsafe. But by doing so, there are byproducts, chemical byproducts, as a result of this chemical reaction that are directly poisonous for the liver, and the liver is injured to the point where you can go into liver failure. Okay? So when you go into liver failure, guess what? There's no other organ that can deal with medication. A lot of people who go into liver failure die because they cannot even digest and process the remedies. But there's also hope. God is a God of hope. There are many herbs that can restore and regenerate your liver. Did you know that?
Praise God.
One of the most famous is basically Silybum marianum, or milk thistle. And remember when I told you that the pharmaceutical industry at the beginning, they started taking plants and try to analyze and see what they can use to make drugs? Milk thistle was one of the first plants that they used, and they make a drug that's called silymarin, which is to this day one of the most successful supplement to regenerate and heal liver conditions, including liver cancer, liver cancer, liver cirrhosis, not cancer. Liver cirrhosis, fatty liver infiltrations, and hepatitis, and all this liver inflammation. Okay, liver cancer is a bit more complicated, but it can help. It can help in liver cancer as well. But it can regenerate the liver. There are also, God's power has no limits. Do you agree? And some of this power has put in the plants that He created for us. And there are certain plants and mushrooms that actually can regenerate nerves. Did you know that? I had the opportunity to help a gentleman who was in that time, he was in his 70s, and he had a terrible car accident. And the car just flipped upside down, and he broke his lumbar spine. It was complete transaction, but not only that, actually the spine exploded because of the impact. The lower spine and basically the end part of his spine, which is called cauda equina, which it's the end of your spinal cord that kind of spreads into a lot of nerve ending and innervates all the pelvic and girdle and muscles and legs. They were completely shattered. So he was taken to a hospital. The neurosurgeon came and said, "Oh my word, I've never seen such a thing in my entire career." So I said, "Well, we're going to need more than just a surgeon here. We're going to need God." So fortunately, that man was a God-fearing surgeon. He prayed. And he said, "I'm going to try to do my best." He finished the surgery, and he said, "Mr. So-and-so, I did all I can. From now on is God's turn. But let me tell you, I do not expect you to ever walk again."
Oh my God.
At that time, he was a paraplegic. Paralyzed from the waist down. No control of bowel and bladder. No control of his feet. No feeling in his feet. Nothing. Okay? And so somehow, we heard about him, so it was like, "Can you help us?" I said, "Well, God can, but there are also herbs and there are mushrooms that can help you regenerate nerves." So I gave him a mushroom that's called lion's mane.
Oh, yeah.
It's one of the most powerful neuro-regenerator mushrooms. It regenerates nerves. Let me tell you, the treatment plus prayer, this man, 1 month later, walked out of the hospital.
Oh my dear.
He still walks today. 1 month later. He was the miracle of the entire hospital. The doctors and nurses were like, "This is impossible. We have never seen such a thing." 1 month later.
Wow.
So this is the power of God, this is the power of prayer, and this is the power of plants He makes. Right? And I've seen amazing response to natural therapies. Amazing response. Right? This is to encourage us to pursue in this knowledge, because there are going to be a lot of sick people that we need to help. And, whether doctors and nurses are going to be available or not, the knowledge of these doctors and nurses and this knowledge of modern medicine cannot help them. It just cannot. Right? Look at this gentleman. He was condemned to be a paraplegic in a wheelchair for the rest of his life. And God healed him, with natural remedies, with prayer, but God healed him. And that is impossible for this medicine. It's just unheard of. It's a goal that they cannot attain. So imagine just the responsibility that we have. You have in your hands the power of Almighty God to heal people that even doctors cannot heal, right? So you're going to be the messengers of hope. God wants to use every one of you. Yes?
How do you use the mushroom?
You either eat it or, you take supplements. So you can grow your own mushrooms, by the way. That's probably would be nice to discuss some other time, but you can grow your own mushrooms. You can. And, one of the best mushrooms I like, reishi. Reishi, for instance, can, help you with heart disease. They have done studies, reishi, for instance, that can cure up to 70-75% of palpitations or irregular heart disease. And it's good for your liver, regenerates your liver. There's so many mushrooms that are good. Excuse me. They have beta glucans, which is the active constituents in every mushroom that they're modulating and boosting your immune system. There's so many things we could talk about it, but okay, let's discuss quickly about poultices. What are the poultices? Anybody? Did you have a question?
Yeah, I've been hearing about black seed oil.
Yes.
And what does it do? What can it do?
Oh, it's good for usually skin injuries or skin infections or anything. A lot of seed oils, they are safer to put on the skin than eat them. Let's put it that way. Some people have used it to actually, have a treatment for certain cancers. Might be a stretch to do that. I would be very careful. When you take essential oils or seed oils, you have to know exactly how you do and what you do it, and always I would recommend you actually use a carrier oil. In the case of black seed oil, some people might feel an irritation on the skin. It can sting, It heals very quickly, but some people can be really sensitive. Yes.
I did experiment with black seed oil more than once, many times. It does sting.
Mm-hmm.
It does the first time you use it. I had many times because I have limited time and maybe have a busy nature or I don't know. I don't go quick over there. I have the knowledge and I'm not practicing, I don't do it. So I had wounds that I neglected them and they were not healed. They will be still fresh, still painful, and after a week I have to do something because nothing happened. So I apply the black seed oil on the skin. It can be big cuts, it can be big injuries. It stings the first time, it does. But the second time when you apply, it does not. Does not, I guess, maybe disinfects, maybe, I don't know what, but it heals many times quicker and beautifully with no scars, no nothing. It does work. It's very good, black seed oil. I don't know internally.
So that's why I would be very careful. I avoided to do this about essential oil. It's we could, that requires probably a workshop in itself. There's a lot of stuff you can do with that, but you have to know how to do it. But nevertheless, I always recommend use a carrier oil because various people have sensitive skins, and they can get irritations. The last thing you want when you have a wound to get further irritation and pain and burning, and you don't want that, right? It can, but here's another thing. Aloe vera, it's one of the best treatment for burns. Anybody got burned? Charlene, my daughter, got burned before we came here. As a matter of fact, the very fact that I am here with my family, it's a miracle. The very fact that I speak, it's a miracle because we were all losing our voice. And I knew this is the enemy. So I asked Nicole and I asked a lot of people, please pray for me because I'm supposed to go and speak. And I know the Lord is going to do something. The enemy is trying to stop me. Yeah. And one of the way he's stopping you is either attacking you or your family. So, Charlene got grade 2 to actually almost grade 3 burn, which is very bad. Yeah. It's usually bad and takes weeks to heal. So, so we knew about aloe vera, we knew about cold, therapy, so we actually applied aloe vera fresh pulp or gel on the burn for a few days. And it healed. You don't have a scar right now, do you? Nothing. You cannot even see. And that takes away, it's by its very nature, aloe vera pulp, it's very cooling and soothing. And it has a lot of, it's a hydrogel, it has a lot of water in it. And what happens when you get burned, the entire kinetic energy of that fire gets deep into your tissues, and that's why it takes so long, because as long as there's heat in your tissues, it's going to continue to burn. right? So, but if you manage to take that heat out of your tissues, then you can start healing as soon as possible. So one of the best ways to put aloe vera pulp, you just cut it open, put it right there, do not take it there, just keep it there for 24, 48 hours, and you will see if it's like a second-degree burn, you have a big blister. That blister is going to just deflate, get back into the skin, it's going to be reintegrated, regenerated, and it's like nothing happened. Okay? But if you don't do that, then that blister can tear, and now you have an open wound that is very prone to infections, because skin is a barrier, right? And there's no better barrier than your skin. That's why you do not want to, break the blister. You want to keep the blister there. Put aloe vera, and it's a miraculous treatment. Just another blessing from the Lord, right? Poultices. So what's a poultice, right? A poultice is basically something that you make, something like a soft mass, right? That you make out of a plant. And you can use various things. So, I think we call here. You can use a poultice. The simplest thing you can do, for instance, it's a poultice made out of cabbage leaf. Did you know that you can use this for joint pain? Did you know that you can use it for infections, for boils? Okay. Does anyone know what pilonidal sinus is?
What is it again?
Pilonidal sinus. It's a very painful infection of your end of your spine. It's right in between your buttocks. It's caused by a bacteria, and it's chronic. People get treated. You go to a hospital, and they always try to, use a curettage, and basically enucleate or take or cut part of your skin out and your flesh, because they say there's a shell, and it's true. There's a shell. That infection is like an abscess, and it has a shell that basically protects that infection from being reached by antibiotics, local antibiotics or general systemic antibiotics. So these people are suffering, and they go to a hospital and get surgical procedures after surgical procedures, and it's recurrent. So they go and they develop this infection over and over again, and it's somewhat genetic, they might say. So one of the best way to treat this is cabbage poultice. And I had recently, I think last year in December, I had a young man. He was 17. He's been suffering for about 2 years with this. They went to the hospital and they tried to treat it, and when they said we need to do surgery, and he was scared the wits out of him, because he was having also anxiety. He was very anxious. So anyway, so I had to treat him for both. But one of the simplest remedies, and they were like looking at me, like, are you sure? Like, we went to doctors, then they gave us like strong antibiotics, and you're giving us cabbage? Like, what is this? It's just like, they're almost like upset, because we paid a lot of money and you're giving us cabbage. So, we don't need that. We could have taken it ourselves. Say, yeah, well, you can, but you have to know how to use it. So I told them, make a poultice. So now we're going to learn how to make a poultice. So what you do is, basically, you put it in a chopper, or chop it, really, really small, and then what you do, you put it in. Let me see if I have here. Do we have like a piece of cloth?
Yeah, you can. Yeah. You can use
This one?
any of these, anything in here. These face cloths here.
No. So here's the thing. It's kind of big, but so you want a piece of cloth as big as a face cloth, which is what, like 12 by 12 or whatever, and so you make it. So it's another thing. What I recommend is, I didn't mention that, but just the interest of saving money and time. But the best cabbage that you can use for poultice is actually purple cabbage.
Okay.
And why? Red cabbage. Why? Because I didn't talk to you about nutrition because, there was so many things to talk about. But you have to know God has created the rainbow. And man, I should say, men that do not know God, they have misapplied the rainbow and they use it for unholy purposes.
Yeah.
But the rainbow is in the sky and the rainbow is in our diet. Did you know that? There's a rainbow in our diet. And so we have to follow this rainbow. And so the closer to the dark colors, purple, red, orange, the higher in antioxidants and nutrients, the more anti-inflammatory they are. So when you want to make a poultice, you want to make a poultice from the most anti-inflammatory cabbage you can get, and that's the purple or red cabbage. Okay, so you get that, you cut it, you whatever, mince it, whatever you do, and then you put it into a face cloth, right, like that. Okay, and then you put it on the wound. If it's a fresh wound or an open wound, just make sure that cloth it's clean, and the most important thing, that cloth has to be dye-free, no dye. Why? Because this cabbage is going to take the dye from the cloth into your wound. That's the last thing you want to do, right? So it has to be undyed, and it would be good to be cotton, organic cotton if you can, if it's available, right? But make sure it's dye-free, no dye fabric, right? So you put it on the wound and you apply like a hot water bottle or like hot pack on it, right? What's that going to do? It's going to enhance the absorption of the good nutrients from this cabbage. So let me finish the story with this young man. Came to me, I examined that. The wound was this big, but the redness was this big, which means that infection would have spread. So, I said, okay. So I marked the round where that was, and I say, I want to see you in a month, but start doing this cabbage poultice twice a day, if you can. Leave it on the place for at least 6 hours. This is how it works, in order for that to work. The parent, they came with the parents. The parent did not wait for a month. He had an appointment or something else. He was just in and out from my office because he was so, excited. So it's like, Dr. Boldi, do you know what happened? I said, what happened? It's gone. What's gone? My son's infection, that thing that we've been trying to fix for 2 years. It took two weeks. How did you do that? I said, I didn't do anything. The cabbage did. Right? So it's like, that's amazing. Like, why didn't doctor tell us it? They don't make money on advising cabbage poultices. They make money on giving you medication. And besides, most of them don't know that. They don't study that in the med school. They really don't. And I wish they did, but they don't. So that's a problem, right? This is how healing this cabbage is. And, if you do a detox, cabbage juice, it's fantastic. It's there's another thing with the cabbage. It's part of the cruciferous vegetables. Have you heard about that? Yeah. What are the cruciferous vegetables good for? Liver detoxification. It enhances phase 2 and phase 3 liver detoxification. So there are 3 phases of detoxification in the liver, and this cabbage, cauliflower and Brussels sprouts and all this bok choy and mustard greens and all that. All of these are actually helping the liver to detoxify your body. Okay, so because they detoxify, they also are very effective on the wound. No matter what that wound is, whether it's infected or not, and also very effective on swollen, knees or hips or whatever. If you have fallen and you injured yourself, you can make a poultice. Yes.
Could they be used when people are like bedridden and
Absolutely. Yeah. It has anti-inflammatory effects, right? So that's what you want. A lot of people are having chronic inflammation. And that inflammatory response basically is destroying their cartilage, destroying their joints, right? You don't want that. Yes?
And you can make a tea or a juice from the cabbage?
Well, I wouldn't recommend a tea. You can make a juice if you want. So if you, for instance, if you suffer with osteoarthritis, I would recommend you make a juice out of, cabbage and celery, and cucumber. You can put some parsley and cilantro in there and apply the poultice on the affected joint. And you're going to see great benefits. Great,
That taste is good to combine.
Yeah, you want to combine. You can put some beets in it. Beets are sweet, right? Yes.
They make a juice, but then they make a poultice. So like,
Well, you have to do them both. If you want, you're going to get double effect.
so I can blend it and drink it, the juice, blend the juice, blend the cabbage.
Yeah. So okay. So now you open another discussion about juicing.
Yeah.
So okay. Do you know how to make a healthy juice? It's not in our handout, but did you know that there are various types of juicers, and some of them are destroying your juice, and some of them are actually not? Did you know that?
Yes.
Okay. Which juicer is good one? Cold pressed?
No, the slow motor one.
Yeah, exactly. They are called masticating juicers.
Yes.
They have an auger, right? So the centrifugal juicers are bad because they spin with like a 1500 RPM, and they create a vortex, so they suck air inside. And one of the best anti-inflammatory natural substance in a lot of fruits and veggies is called quercetin. And quercetin is actually oxidized, so it's inactivated by light, temperature, and air. So when you do that vortex, when you have that fresh juice and you say, wow, this is going to be just a lot of enzymes and a lot of minerals and vitamins, you create that vortex, all that air comes in contact with all this quercetin and allantoin and vitamins and minerals and oxidizes probably over 90% of them. So at the end of it, you're going to drink colored water with no nutritional benefits.
And it's so much work.
Right? So and you get only the juice and the pulp and the fibers are left out. You need the fibers. Why? Because the fibers are prebiotics. Your good bacteria counts on you to give them fibers because that's their food. And in exchange, they make melatonin for you, they make vitamin K for you, they make all sorts of B vitamins, they make all sorts of stuff. But if you starve them to that, guess what? There are things like yeast, like candida, that takes over. And you get an yeast infection. Right? Or maybe other bacteria, pathogenic bacteria, and then you start having mental problems and other problems. So, do we understand the decoction, the poultice, how to make? Very easy. Yes.
Do you destroy the quercetin if you cook the vegetable?
Yes, you do. Because you boil it. You boil it. So if you want quercetin, you need to have it in natural raw. Right? So this is why. It's another thing. Talking about juices. So a slow moving, which is called it's a masticating juicer, but they use an auger, right? They use an auger. So that auger moves with about 70 RPM, 70 rotation per minute. So from 1500 to 70 is a huge drop, right? And because it moves so slowly, it's basically a cold press, like Sister Khadija? Yeah, like you said, right? It's a cold press. But the thing is, they have special properties. You can get juice out of the pine needles. Did you know that?
No.
That's how powerful they are. You can get juice out of anything. And it's one of the few things that you can get, barley juice, for instance, out of barley grass, right? Huh? Or wheatgrass, yes. Yes. So, and another reason is you do not want this juice to stay, you can keep it in a fridge for up to a week, but you want to drink it fast. You want to drink it fast because the more it stays in contact with air, it's going to get destroyed. Okay? Okay, so now, same thing. You can do a poultice out of, cabbage. You can do a poultice out of comfrey. Remember we talked about comfrey? Very good for also infections, for inflammations, for even broken bones, for ligament problems. Very good.
Do you put
Okay.
anything else or just concrete?
No, concrete? Yeah.
There's some there too.
Yeah. So now, charcoal portraits. Do we have charcoal?
Yeah.
So let's do that.
Here's your charcoal,
Okay.
and here's your flaxseed.
Let's see if it works.
You need a
Is this
spoon?
flaxseed powder?
Well, I grinded it, but I didn't do a great job, so don't look too close.
Okay, you're gonna. Yeah, I don't know if that's gonna work. I'm gonna try. You need to have it powder.
You need a spoon and a bowl.
So yeah. So what we can do is we can do. How do we use charcoal portraits? Like what do we use the charcoal for? Do you know? Poison. Not only that. Any kind of poison, whether we get like a bee sting or whatever, wasp or yellow jackets, whatever. Even if you get bitten by a poisonous snake, use it right immediately. Infections, boils. Thank you. Infections, boils. You can use that, right? And another thing is, if you have very high fever. Yeah, very high fever. Some people and a lot of children can get seizures from high fever. Did you know that? Yes. So it's already dangerous. So I wouldn't let the child to have 41 degree 0.5 or something. That's no longer beneficial. It's dangerous, right? As long as like between, let's say, 38.4 to 39.5, I would not go higher than that. That's enough to destroy viruses and bacteria. If it gets really high to 41, then that is such a high temperature that some of the proteins in your body starts coagulating. That's not good. Imagine that your insides are becoming like an egg, boiled. Right? It's not good. So, and the problem with seizures is that a high temperature can cause seizures, and seizure can cause brain damage if it's long, right? You don't want that. And plus, they impair your capacity to breathe, so you can choke, or they can vomit in the same time they have seizures, and they vomit and they aspirate in the lung, and they develop a pneumonitis or pneumonia or something. You don't want that. So charcoal is very good. If your child has 41 degree temperature and you cannot lower it with any way, put it in the cold shower, nothing works. Even charcoal. The charcoal is going to bring down the temperature within minutes. It's very powerful. If you have septicemia, you can take charcoal and actually absorb the toxins from your blood, and it's going to help you fight that infection, right? So ideally, you're not going to wait until you get septicemia. It's a very dangerous situation, right?
How to give them that?
You just drink it. You drink it, yeah.
Children, it's good to give it with apple
Yeah,
sauce.
you give it with apple sauce or anything.
Banana,
Because you,
then it's
yeah.
okay.
You don't want to, because they're going to blow in it or they're going to breathe in, and they're going to choke in that powder, right? You don't want that. So yeah, that's one of the best way to take the charcoal. You mix it with applesauce or some sort of sauce, right? Yeah. So okay. So what we do?
How much would you give a child?
Depends on, so the dose for an adult, think of that. The dose for an adult, it's usually, depends on if you have tablets, I would take 2 to 3 tablets in one settings, 2-3 times a day. Make sure you drink water because that can constipate you terribly, right? So the dose for 12-year-olds, it's half the dose of the adult. The dose of 8-year-olds or younger, it's 1/4 of the adult. And the dose of babies, I would refrain myself to give it to newborns and very small babies, right? You want to see someone, right, that knows more than you do to deal with that, because it potentially can be a very dangerous situation. There have been cases in Canada that people have gone to the doctor too late. The baby had septicemia and they went too late and the baby died in the emergency department. And the parents end up in jail. Because, they went to a naturopath, the naturopath recommended them to go to emergency department and they refused. And they went to emergency department after a day or two when the baby was too sick to be saved, literally. So you cannot play with babies, right? You remember that. So as a rule, if anyone is less than, let's say, 8-year-old, 7-year-old, you want to see a doctor, right? Because of their big surface area, right? They and very tiny blood pool. If they lose blood or if they have an infection, they can go sour very quickly. They can go septic within 24, 48 hours. Usually for adults can take you a week until you get septic with an infection. Sometimes it depends on the infection. But with babies, they can turn blue and they can stop breathing, and within 24, 48 hours, they're very tiny, right? So it doesn't take long for them to get septic. You don't play around with babies. No.
Any kind of charcoal?
Activated charcoal usually.
And you can destroy the carrion capsule and just take your own too.
So you put 2 teaspoons of charcoal. And then you put 2 teaspoons of flaxseed, grounded flax. Oh, by the way, something very interesting about flaxseed. Do you know anything that can actually reverse DNA damage and regenerate your telomeres? Do you know what telomeres are?
Yeah.
The telomeres are actually, the length of the telomeres are giving us our lifespan. With every DNA replication, and the DNA replication happens when a new cell is formed. The telomeres are becoming shorter and shorter. When those telomeres are gone, your life is ended. Because there's no more replication, there's no more healing and regeneration. You die. One of the things that you can actually make your telomeres to actually grow, did you know that? You can do that.
Yeah.
It's flaxseed. Yes. Yes. Well, it's recommended for adults that you have a couple of tablespoons of flaxseed every day. It's one of them. There are other things that can regenerate. For instance, apples, pomegranates, garlic, and other stuff. But flaxseed have been studied extensively, and apparently it has the power to extend your telomeres, which means basically extending your lifespan. And God has made flaxseed. Do you see how God's desire is for us to live? He does not want us to die. Yes?
The DNA would have to be broken, the seed would have to be broken open over. You couldn't keep the seed.
No. So you have to ground. So here's a tip with flaxseed. You want to keep the flaxseed, in a seed form. When you use it, you ground it and use it immediately because it gets oxidized. And once it's oxidized, it loses most of the properties. Right? So you only ground the flaxseed amount that you use immediately. Do not ground the flaxseed and keep it in the fridge. You destroy it. Yes. 2 tablespoons. Yes. You can put it in. I don't know. I haven't seen people trying to sprout flaxseed. I don't know if you can. Well, yeah, maybe. I haven't seen anyone. You can try, Nicole. Be a pioneer in this. But here's the thing. So you want to use the flaxseed, but it's not the only one. You can use other seeds, right? When you use the flaxseed, make sure you use it immediately, and even if you keep it in the fridge, it's going to oxidate. And you're going to use the benefits of omega 369. Have you heard about omega 369? What are they good for? Anybody know? They're good for everything. They're good for your heart. They're good for your skin. They're good for your eyes. They're good for your prostate, for your ovaries. They're good for your everything. It actually good to prevent cancer. It's good to treat cardiovascular diseases. It's good to treat autoimmune diseases. It's very good anti-inflammatory. People who have chronic pain, like osteoarthritis, or you have chronic conditions like ulcerative colitis, or you have a lot of chronic conditions with a lot of pain, with a lot of inflammation. Flaxseed is very anti-inflammatory, and everything that has omega-369 is anti-inflammatory. And so I recommend patients who are having hypertension, they have diabetes, they have a lot of metabolic diseases, to get omega-369, whether flaxseed or other seeds, or there's something that's called ahi flour. It's a flour that's actually very rich in omega-3. Ahi flour. It's called ahi flour. So now there's another thing. Omega-369, they're all beneficial. However, some of the nuts are very rich in omega-6, which is arachidonic acid, and they can cause inflammation. And one of those things is peanuts. So I have seen people eating peanut butter having a heart attack. I had a gentleman in the emergency department, bless you. I have a gentleman in the emergency department that was eating peanut butter every day. It was like 6'4", and he was a farmer. He was like really heavy, duty work. And he came in with chest pain, and he had a heart attack. And we asked him, like, do you smoke? No. Do you drink? No. His diet was pretty good. And so, what's your diet like? What's your favorite food? Oh, I love peanut butter. I eat peanut butter every day. How much? Oh, quite a bit. I said, and we came to the conclusion that he had a heart attack from peanut butter. And for longest time, I couldn't understand why. But when I got to this naturopathic school, and I learned that actually peanuts are very rich in arachidonic acid, which is pro-inflammatory. That's not all. Peanuts can actually get contaminated with a fungal infection. It's a fungal contamination, right? And that fungal contamination can actually lead to liver cancer. And especially with the peanut that is sitting on the shelves for a long time, and they can get rancid, and they can get this fungal contamination, right? So, be very careful with peanuts. I do not recommend to eat a lot of peanut butter. Try to stay away from it. If you have, fresh peanuts, but peanut butter is very susceptible. There's a very big study that was done in the 90s that's called the China study. Has anyone heard of it? China study was done by a Cornell University professor, and he was trying to find out why people who are in the development, like in developed countries like North America, why do they have a higher rate of cardiovascular disease and osteoporosis? And he was actually raised on a dairy farm. And he looked into, at that time in the 90s, they thought milk and dairy products are one of the best sources of protein. And so he did this study, but he did the study for another reason. At that time, the Prime Minister of China was sick with cancer. And he hired this professor to find out a cure and what is the reason why China has increasing incidence of cancer, right? So when he did the study was about 10 years, and they tested and they observed over 100,000 people from rural China and urban China. And what they discovered was astounding. When they published their study in China study in 1993, they discovered that actually dairy products are causing a lot of problems because they have this casein which causes inflammation in the body. And not only that, but it causes a steal of calcium, it causes osteoporosis. So, and they were all flabbergasted. Of course, the industry was up in arms, and they were trying to sue him, and they managed to fire him from the university, and he lost his university position because, it's politics. But this gentleman actually met with another physician who is called Dr. Esselstyn, who was a cardiovascular surgeon. And independent of him, he did also some studies, and he found out that, indeed, dairy products are not very good, but also diet is very important in your health. And so Dr. Esselstyn treated 250 cardiac patients, and also he lost his position because of that, by the way. And he treated them with diet. All these patients were candidates for open heart surgery. An open heart surgery can cost up to $250,000 in the United States. It's a big revenue. And he dared to treat them with diet. And guess what? He did angiograms. So, he went with catheters inside the coronary arteries and took pictures. And at the end of 2 months treatment or 3 months treatment, they again did angiograms. And the coronaries of these all patients, I think only one dropped out of the study, but all these 250 patients, all the coronaries, all the vessels were crystal clear, like babies.
All my dear, that's what the
Diet. And when he published his study, he got kicked out of the Academy of Science. He lost his position as professor. So you see how powerful, the big pharma is. So unfortunately, it's a corporate world. What can I say? But that will not negate the fact that diet is very powerful. And this China study is actually showing that osteoporosis can be caused by dairy products. It's not protecting you; it's actually caused by dairy product. And the things that can protect you is, we ate today. Praise the Lord. Cauliflower, broccoli, cabbage, sesame seeds have a lot of calcium in it, right? A lot of yes.
Is it because it speeds up the process of the bone, so it causes, as a person gets older, to degenerate and break apart?
Were you trying to what?
Consumption of dairy products.
No, the consumption of dairy products causes inflammation in the body. It literally causes inflammation in the body and causes an imbalance in the calcium and magnesium and all these minerals. And there's a constant inflammatory response. There's another study done in I think it was 2003 or 2005, done by a pediatrician. And she noticed that, the patients in her practice, a lot of them would get upper respiratory tract infections, otitis media, sinusitis, throat infections. So he noticed that a lot of these people, a lot of these parents are just using a lot of dairy products in the diet. So she did her studies and she recommended all her patients to stop giving milk and dairy products to the children. And when she published the study, it was again a big hit because up to 78% of their, of her patients cleared the infections just by removing dairy products from their diet. Okay, so anyway, so I'm not sure if this is warm enough. Let's try and see what happens. Yeah, come on, that's all. So I'm going to try to make this poultice. Basically, you need to get a paste. Okay.
Like usually I take charcoal, whenever I eat like food poisoning, maybe I get something, I eat something and my food is just that.
Yeah, you can get charcoal with food poisoning, yes.
Yeah, I
It's good.
always lick it first because that's how comfortable I am.
Okay, yeah,
And I drink water, a lot of water immediately
Yeah.
because it
Yeah.
really choke me.
yeah.
Yeah, or do constipation. But it helps a lot, like it doesn't absorb
you put too much water here. But anyway, you need to make a paste. So what you do, you apply the paste again on a piece of cloth, and you can put, well, I have no one to put it on, but you understand the concept. So you need to make a paste, you put it on a piece of cloth, you cover it, and you put a plastic wrap just to cover, because it's going to be messy otherwise, right? And you keep it there, the same thing. Keep it there for 2 to 4 hours. You can change it if you want every so often, but just keep it there, and it's gonna take the infection away. It's very good for infection, for poisons, for boils, for abscesses. For if you have an abscess that it's fluctuant, so what does that mean? It's you can feel that it's liquid inside. That's a term that doctors use out. It's an abscess, fluctuant abscess, so we can incise it. Some of the boils or the abscesses are hard. That's not a ripened abscess. You put charcoal, or you can put cabbage, or you can put, and then it's going to collect all the pus into one place, and then it's going to open itself. And you have to be careful with potatoes. There's a lot of potatoes. I know you grow a lot of potatoes in PEI. So I don't know how many potatoes are genetically modified or not, right? So be careful with that. You don't want to put genetically modified potatoes. But we appreciate potatoes from PEI. They're good. You can put a potato, you can put a cabbage, you can put charcoal, all of them. So that's going to help, drain all that, or help the accumulation. It's going to drain the pus, and it's going to clear the pus, and continue to put it, and it's going to absorb all the toxin, all the microbes, everything. So it's going to help with healing, right?
Doctor, I have a question.
Yeah.
You talk about the flaxseed.
Yes.
When you go to the Walmart and you can buy ground flaxseed, you are buying garbage then?
Yes, you are. You are buying garbage. I'm afraid so. Yes.
From a grocery store? Yeah.
You never do not buy grounded flaxseed. It's spoiled. It's spoiled. Don't buy it. Yes. Yeah. Well. If it's grounded, I mean, they should know that. They should not sell that, because it's probably oxidized, so it's not going to help you in any way, shape, or form, right? Those omega-3, 6, 9, which are so beneficial, are gone. They're gone because they're oxidized by the contamination, contact with air. Yes. For what? Nut allergy. Allergies, it's something that's difficult to treat. You have to look into the gut. So it can be an imbalance in your gut. I would try in the beginning to do maybe something with, as I said, rosemary and stinging nettle. Quercetin is very useful for that in allergies. It's anti-inflammatory. But in children, it's going to be hard. You have to see what's going on with their gut. A lot of times, one of the most common reason for allergies in children is that they can have pinworms, or they can have intestinal parasites. That can cause allergies, right? So if you have pets in the house, it's 100% sure that your child has, intestinal parasites. It's another thing. I am treating a lot of people doing parasite cleanses, because a lot of people have all sorts of symptoms that cannot be explained. And a lot of symptoms are headaches, joint pain, chronic bloatiness, gas, constipation, diarrhea, alternating constipation, diarrhea, skin rash that doesn't respond to any treatment. And so when I do a bowel detox and I do a parasite cleanse, everything goes away. And a lot of people, even psoriasis sometimes can be caused by intestinal parasites, and they did not know, right? And they use biological, they use very strong medication, and as long as you take the medication, it's suppressing the immune system, and the skin clears somewhat. But as soon as you stop the medication, then the immune system is again back in force. So here's what people need to understand. This is what people need to understand with skin conditions. As I said, when your body is trying to send you a message saying there's something wrong in your gut, in your liver, in your blood, and that message is a skin rash, that's a sign that your gut, your liver is in trouble. Do not suppress or do not suppress the immune system. Don't smack in the head or don't kill the messenger, so to speak. Right? Do not kill the messenger. The body is trying to tell you there's an imbalance, there's a poison, there's a parasite, there's something that I don't like, and I'm trying to get rid of this intruder. And, this is the effect, so do something. The more you ignore this, the worse it's going to get. Your body is trying to get your attention. Sometimes simple as stopping eating sweets, it's going to help. Stop eating certain, processed foods that have additives in it. And if we start talking about additives, we could just talk until tomorrow night. But one of the things that you have to be absolutely aware and dread it and run away the other direction is things like polysorbate 60 and 80. It's everywhere. It's in candies, it's in pickles, it's in a lot of foods, canned food. Polysorbate 60 and 80, they put it in drugs, in medications, by the way. Sometimes in other things, polysorbate 60 and 80 literally wipes out your mucus protective layer in the intestine. What that does, it causes autoimmunity. It causes your own bacteria to attack your intestinal lining and cause inflammation in your gut and something that's called leaky gut syndrome. Okay? So polysorbate 60, if you see that on a product, put it back on the shelf and say, thank you, but no thank you. Okay? Do not eat that product. You're going to harm your gut, and it's going to be difficult sometime it's going to require a lot of work to restore that, protective mucus layer, right? So some of the food additives are just so dangerous, they should be banned like regular poison, really. Yes? Antifungal properties, there are lots of herbs. One of the simplest one is, we talked about essential oil. If you, for instance, if you have a onychomycosis or a fungal infection on your toe, the simplest treatment, the most effective treatment is, which equals in power and actually faster than the fungal treatment, is tea tree oil. Apply tea tree oil every night. That should take care within a couple of weeks. Usually it takes 2-3 months if you take an antifungal, and they're very toxic, they're very poisonous. But tea tree oil, you apply it locally, it's very good. Clove oil, it's also good. There are a lot of herbs that are good for that. Yes.
Okay, any remedy to help with constipation in children?
In children?
Any natural remedy?
Yes, water. So no, there are many, but I know that children do not drink water, and a lot of adults as well do not drink. So here's the thing: in order to have a regular bowel movement, you need 2 ingredients, just 2: fiber and water. If any of these ingredients it's missing, you have a problem. Okay, so if you have too much fiber and no water, you can get constipated. I had seen patients in emergency department, they were taking Metamucil, and they got worse. They were taking, a lot of fibers, and they got worse because they're not drinking water. You're just adding to the problem. In order for your bowel to actually move along all the waste, that waste has to be, soft and has to be moist. If you take too many fibers, that fiber, what they're going to do? They're going to do what they're created to do. They're going to absorb water. So they're going to actually dry your bowels, which is the worst thing to do. Because when you dry your bowels, all those fibers are going to start irritating your bowels. You can start bleeding. You can start having inflammation in the bowel. You can even develop, diverticulitis or diverticulosis. Inflammation of your bowel and infection of your bowel, right? So drink water, lots of water. I had to deal with a lot of children that they're constipated, and by simple fact of increasing their water intake, they solved the problem. Yes? Okay. Now, so we've done charcoal poultice. Okay, castor oil pack.
So what do you do with that? How do you apply it? Because it's too messy. How do you do that?
No, look, it's already thick. See that? So the flaxseed actually turns into a jello and binds it together. So now you take a piece of cloth. You take a piece of cloth. Let me see if I can cut it. I'm going to cut a piece of cloth. Exactly what you want to have. Okay? There you go. So you take a piece of cloth. You put it on it. See that? Just put it on it. Okay? And you apply it on the wound. Okay? And then you cover it.
Back or just put it like that with that?
Well, you can put it like that, but usually what you do is you fold it like that, you can put it like that, so it doesn't get messy, right? It's still gonna work.
Some clean foil.
Yeah, so you put an elastic bandage, and you can even apply, heat on it. Okay, so that's what you do. Now, what was the other thing? Castor oil pack. So, castor oil pack, it's very similar. You take castor oil, a piece of cloth, the same thing. You take a piece of cloth, face cloth, make sure it's undyed, and you put, usually 4 tablespoons of castor oil, or you can even have a bowl. Put the castor oil in there, put the cloth in it, and soak it well. You soak it well. And then you put it on the area you want to treat, and again cover it with another piece of cloth or a plastic foil, and keep it there. Now, castor oil, you have to keep it at least 6 hours, otherwise it's not going to work. So what I recommend, you keep it overnight. Tie it well, whether it's your belly, or your leg or whatever. Tie it around there; it's not going to move, right? And keep it overnight. In the morning, you take it off. And next night you're going to do it again. So you can use multiple times the castor oil, by the way. Okay? You're going to use it multiple times. It's a very good liver detoxifier. You can put it on the liver. I hope everyone knows where the liver is, right? It's under your right side of your ribcage. So you put it on top of your liver. If you want to do a liver detox, you can get herbs, and you can do a liver detox with tea. But also you put the castor oil pack on it overnight. That's going to enhance the liver detoxification. Also, if you have the same thing, if you have an abscess, or if you have, for instance, a growth, whether it's bone growth or flesh growth, you can put it on it. The castor oil has the properties of actually dissolving bone growth. So if you have bunnies, you can try to use castor oil. It might work really well, right? It's going to be a little bit tricky to kind of wrap it around your toes, but I wouldn't even bother wrapping around your toes. I would put the whole foot. Just put the whole foot in the castor oil. It's not going to harm you, right? It's not going to harm you. Put the whole foot and wrap it well. Put a sock on top of it and sleep with that. And you can find a lot of relief. Yes.
Is it also for arthritis?
Yes, you can use it for arthritis too. Yeah. But I would try something that's less messy in the beginning. I would try the poultice, the carrot poultice first. You can use that too. Yeah.
So for the liver detoxification, you would just down a floor with the
the same thing.
put it, wrap the stomach over.
Yeah. So. I can do it here, but then I don't know what to do with it.
I'll take it home and use it.
Well, yeah.
Yeah.
But it's very easy. Again, you get a piece of cloth, right? You get a piece of cloth, so it's going to be like, let's say 12 by 12, whatever. Again, undyed, and put it into a bowl and soak it well, but it's soaking in such a way that it's not going to start dripping. And you start dripping too much, right? So soak it well and put it there. Right? And keep it there. Wrap it there around it, put something so you don't mess your bedsheet or whatever, and it's not going to move. Because in the morning it's not going to help you, but in the morning you find it over your spine or over your spine. If you have back pain, yes, it can help, but, right? So, try to keep it in place, and there are ways to do the wrapping. So, one way, Nicole, do we have a bandage of some sort?
To wrap it up,
Well, I just want to demonstrate a very simple thing.
can you use tape or,
Okay, so-
medical tape or this? Or do you want me to, I'll look for bandages.
Here. So I want to teach you a trick, which is a trick that actually doctors and nurses are learning. How to make a bandage, how to do a wrap, a bandage that it stays on the limb, is not to fall off.
Oh.
So you have a volunteer. Anybody? Anybody wants to play the sick person?
Anybody want to play? We have a player.
I'm going to show you. It's a very simple process. So, let's say I want a bandage.
Can you move more this way? All I can see is that.
So this is the charcoal pole, right? Put it here. And I wrap it. So now this is too wide. What I do is when I wrap this, and in order to keep the bandage on, I twist it. I twist it and put it this way. And then I come over another round, I twist it again, and I put it there. And that way it's going to be tight and it's not going to fall off. Very simple thing. You twist it.
And then you put a pin, a safety pin?
Well, no, do not use the safety pin.
So what do you use tape?
You use tape.
Okay.
It's a medical tape that you use, and they're very good.
I have
It's called,
one.
what it's called, it's called Medical or whatever brand. But this is what you do. This is what you do. So you put it on the limb, and then you twist it.
Yeah.
And then continue wrapping, and then you twist it, right? So that way you actually make it tighter, and it's not going to fall off, right? And also another thing, when you actually bandage a limb, start from the smaller part. If, for instance, I start here where it's thinner, and I go up when it's thicker, and then come back here. Because if I start here, it's going to be too loose, it's going to fall off. Make sense? So when I start here, I do a wrap, the first wrap, twist it, and then continue up, and then come down, twist it, and then tie it here or put bandage, whatever, a tape. Right? So always start in the thinner part. You do a double wrap and twist it, you go up and come down. I mean, this is something useful also that you could, really call how to make bandages.
Yeah.
I'm sure there are any nurses here?
Yeah.
Yeah. So, you can learn stuff. I mean, this or how to make an arm sling. It's very useful. If you burn yourself or if you injure yourself, you make arm sling. We need to learn this stuff, right? Very useful. Okay, so casserole pack, and I give you the recipe. Okay, hydrotherapy method. Finally, so we're here. Okay, this is what you do with hydrotherapy. Yes.
The hydrotherapy, it says the contrast shower. It's the one that you said cold and hot. You did not mention how many times, how many minutes, seconds, or whatever.
Okay.
Into the contrast shower.
Okay, so I'll tell you that. Contrast shower, anybody knows what contrast showers do for?
Your immune system and your blood cells.
But as I mentioned, remember I told you about my shoulder? You can do that for any injuries. You can do that for, a swollen knee. You can do that for anything, basically. So the way the contrast shower works, and water works, and hydrotherapy works, the difference between temperatures
will force the vessels to open and close, which means brings more nutrients and oxygen to the affected side. It also gonna, carry energy with it. The water is electrically charged, and when it flows and touches your body, carries that electrical charge into your body. And I could have another different, whole different lecture about the fourth phase of water. There's been extensive studies how the water actually can be used and why the water is more beneficial than other things. And flowing water is more good than static water. Why? Because the flowing water carries energy more. If you see a mountain stream and you get in the water, that water is very healing because as it flows between the rocks and hits the rocks, everything has electric charge. And it carries and borrows that electricity, and the water carries it along. Now, people have asked us, like, can I do hot and cold showers, or can I do hot and cold, in a basin? Yes, you can, but it's not going to be the same effect. It will help, but I noticed that it's more beneficial if you have a shower. Why? The water is flowing. And then as it hits your body, it carries that electrical charge. And everything about electricity. Everything. I mean, our brain works with electricity, our heart works with electricity. We make electricity. Did you know that? When we eat, the main purpose of us eating is to make electricity, to make ATP, energy, molecules, electricity, everything. There's an electrical charge everywhere. There are things that are called proton pump, not proton pump, they are sodium, potassium pump, calcium, magnesium pumps. There are also iodine, sodium pumps. These pumps are basically proteins that are exchanging ions, or they're exchanging electrical charges or electrical molecules and mineral molecules between the cells in the extracellular space or blood. So there's a lot of electrical changes in our body at every nanosecond. We are very electrically charged. This is why the electromagnetic fields are so damaging to us. Okay? They're very damaging. If you have a house close to a power, pole or whatever, not power pole, but those power towers, they have checked the electromagnetic field, and every house within 1 kilometer radius is in a very powerful electromagnetic field. These people have a lot of health problems, and a lot of them develop leukemia, cancers of all sorts, chronic pain, chronic headaches, autoimmunity. Our body responds to electricity. This is why Wi-Fi, 5G technology is damaging. This is why, but I want to say something, but probably the PI powers is going to sue me next time. But here's the thing: the electrical devices, they all carry electrical, like electromagnetic fields. Your phone carries electromagnetic field. That's why a lot of women develop breast cancer because they keep their phone in their bra or in the front pocket. Some people have developed brain tumors because they were just, talking on the phone instead of using the Bluetooth or instead of using, other methods, right? So that electrical field around your phone is about 10 inches. So when you put your phone here, 10 inches is way past your head. So your entire head is bathing in the electromagnetic field. That electromagnetic field is much higher than your natural electromagnetic field. You have an electromagnetic field. Your electromagnetic field vibrates 4 to 7 times a second, which means it's 4 to 7 hertz. Okay? We're talking about this technology, and we're talking about 2.4 and 5 gigahertz. So there are hertz, there are kilohertz, which is 1,000 times stronger, and there are gigahertz, they're 1,000,000 times stronger. What this does is it starts making your cells vibrate very quickly. consumes energy and makes you tired, and shatters the energy plants in your cells, which are the mitochondria. Your mitochondria is using food, is using to make electricity, to make ATP, and to actually to give energy to your DNA to unravel, to open, replicate, and get back again. So the chromosomes that you are probably heard of is the DNA which is packed. God is in His infinite mind has put all the information about every protein in our body in this chromosome. But there's so much information that you have to pack it some way in order to be available in every cell of the body, in the nucleus. So the way He did that, He did the double helix, and then He wrapped it, and then He used proteins that called histones, and they wrapped it more, and wrapped it more, and wrapped it more, until you have the chromosome, right? So those chromosomes, every time your cell replicates, those chromosomes are unraveling, they're opening, and the DNA actually, it's untwisted and it stretches. So the proteins like mRNA messenger and all these proteins that are reading the DNA, they're able to go from from every nucleotide, which is the building blocks of the DNA, and read your DNA so it can actually create a new cell. It is a miracle of God that He created that. So, and here's the thing that you might not have known. This DNA, there's a helical. There are two strands that are called twisted, right? And they are tied together with protein bonds. And these protein bonds, they go every fifth or every 10 of the nucleotide. When you translate the numbers into letters, the Roman letters, the Hebrew letters, and other languages. But the Hebrew letters, every letter corresponds to a number. Did you know that? Yeah. It's similar to Roman letters, right? So when you translate these letters into the Hebrew letters, you translate translate the numbers into the Hebrew letters, right? What you get is YHWH. YHWH. Do you know what that is? Yahweh. So the name of God is inscripted, it's embedded in your DNA from one end to another through these bridges. So the name of God is actually in your DNA. And that proves that we are a creation of God, because every artist is signing his creation, right? Painters are signing their creation. Sculptors are just signing their creation. God did the same. He put the signature on our DNA, literally. So it's amazing. So anyway, I digress with all this electromagnetic field, but.
We didn't bring our pajamas though.
Yeah.
This is so good.
So constitutional hydrotherapy. What is the use of this constitutional therapy? Any sickness. Any sickness. Any sickness, it can be pneumonia, it can be autoimmunity, it can be a simple cold, flu, it can be osteoarthritis, it can be cancer, it doesn't matter. Any sickness, it's useful. Because what this does, as I said, it's pretty much like the showers, right? But in this case, you use towels, right? So you use towels, and what I like to do is use 2 towels, right? So you go back and front. So you start with the front, and you have, if you don't have running water, you can use a basin and put hot water, and the water has to be about 42 degrees, 41, 42 degrees. So hot enough to make sure it makes this towel hot, but not too hot to scald you, right, to burn you. So, and for your information, temperature is about 55 degrees is going to burn you. It's going to cause first degree burn. And about over 60 degrees is going to cause second-degree burn, and it's going to get worse. So you don't want to go higher than 42 degrees, right? So 42 degrees, you put it inside, you ring it, okay? And what I do, I roll it. In order to keep the heat inside, so you do this, right? You put it inside, and then you roll it quickly, right? And then you go to the patient and unroll it and put it there. If you roll it, you keep the heat inside. And you put it, so you put one here, one there, and you start with the chest. And you keep it there for 5-10 minutes. And then you change this, while, so you have to be quick, you have to organize yourself. While the patient has this hot towel, you prepare the cold towel. Same way, right?
With
Everything there. Yeah, so the water has to be 10 degrees, very cold, yes.
But when you put the hot, do you cover with something?
Yes, you cover, yes. You cover with another, you need to have a bath towel, so you cover it, right? So you put this on, and then you cover with a towel, right? Or even if you have a blanket, you can use a blanket, right? So, and while the patient has this hot towel, you prepare the cold towel to do the same thing. After 5-10 minutes, you use them. Put cold towels, same thing. You cover with the towel or with the blanket.
For the same amount of time for hot and cold?
Yeah.
Oh.
Yeah. And what I like to do, I do 2 sessions. Hot, cold. And then the last one, I think the protocol I wrote. The various ways you can use the cold phase. They say 10 minutes. What we learned in the college, we actually did hot cold, and then the last one we kept it longer. We kept it like 15 minutes. Yes.
So you do on the front part,
Yes.
and then you
turn and you do the same thing on the back.
Is it better than the shower?
It has a different effect. First of all, you want to do this in patients who are not able to get in the shower. They are too sick to get in the shower. And I have this kind of patients. They are not able, I went there to examine them, they could not sit up in bed. I had to prop them and actually listen to their lungs. They were too weak. You cannot have them in the shower. They're going to fall and hurt themselves. You're not going to help them. So this is very good for patients who are very sick and they cannot move. They cannot get in the shower. If they can get in the shower, sure, it's much easier and it's good.
Can you use this on all the patients?
Pardon?
Can you use this therapy on all the patients?
Yeah, patients that maybe they have mobility issues, or they cannot move, or they're too sick to move.
Has the water been too hot for that?
No, it's not.
It will not burn them?
No, 42 degrees is not going to burn. It has to be 55 degrees or above to
For
burn.
a patient with older, like 70 years old.
No, it's fine. I use the same temperature for patients that are 70, and they're fine. So you test the water or the towel. If you feel like it's really too hot, but usually 42 degrees is the limit of the safety. You don't want to. So we used to actually do pit baths. Immerse the whole patient in the water that's mixed with pit, which is a soil that is very high in aromatic oil. And we immerse them in 42 degrees, bath bath. That's 42 degrees, so very hot. That's why we recommend the patient to drink constantly. And they would stay there for half an hour, 45 minutes, and they would constantly drink water. But it did not burn. 42 degrees was not burning anyone. Okay?
Is the shower 3 minutes and 30 seconds?
Yes.
3 minutes, okay.
Yeah. So I was doing it this morning, and I haven't done it for a while. So you kind of one way to take the cold water is to start dancing. And start singing it. And it's hard in the beginning, but as you do it every day, you get used to it, you're going to enjoy it. And it's going to be really good when the hot weather comes, you're going to really enjoy it.
It's so funny to hear the sound when they go in the cold shower.
But it's there, you will feel the effect from the very first shower.
Do you rest after Dr. Boldi, or?
Rest, what do you mean rest?
Like sometimes they say that it's more beneficial if you have a little rest for 20 minutes after,
You don't have to.
Okay.
If you do sauna, yes. With sauna, it's intense detoxification. You stay in like very intense vapors there. And by the way, water and vapors, are transmitting temperature very much more efficiently. So what I recommend, if you have sauna, for the purpose of detoxification, I recommend you get out of sauna at the end and have a cold shower. Yeah.
even infrared.
Yeah, it doesn't matter. Any sauna. You have a cold shower because why? When you sweat, all the toxins are going to be on the surface of the skin, so you want to flush them off.
Yeah.
Right?
Thank you.
Yeah. Yes. Everybody. Okay. So, do we understand how to do constitutional?
You couldn't get up, go in the shower.
Yeah, I mean, if you can get in the shower, I would rather have you in the shower because, as I said, remember as I said, the flowing water carries energy, which is much more effective than static. Right? This is why pools and lakes are never going to be as good as rivers. Right? Well, yeah, sea has other benefits. Sea has like dozens of minerals, has like 82, 84 minerals. Right? But I'm talking about mountain streams, right? So mountain streams, they carry their water and they carry their electricity, right? And this is why the ozone in the air is electrically charged, where you have moving water, right? Yeah.
So, going into a sauna, going into a cool shower, you have some of the same benefits, but a little different because the sauna is just that's the way
so sauna is basically primarily for detoxification. And constitutional hydrotherapy is to stimulate the immune system to fight the infection, right? And it's basically immune system versus detoxification. You can do them both, obviously, but they have different purposes.
What about what the sauna gives you because it dries up your sinuses? Like, can you think of anything you can?
Oh yeah, very simple. Have you seen a seaman having any sinus infection or blocked nose? They don't. You know why? Because the seawater is salty. So all you do is add a little bit of Celtic salt or Himalayan salt in there.
In the sauna, where do you put it? Like just not in the dish.
Yeah, because you can do that. Yeah. So you need that vapor to be a little salty. It's going to just clear your
So put a bit of water and salt in the little bowl.
How do you get? Yeah, yours is infrared. So yeah, you can try that. But if you do hot vapors, that the machine that is dispersing the hot vapors, you actually put salt. But you want that salt to be in the air too, really, so you're not going to have that problem.
Really? Thank you.
Yeah. So that's one thing. So try that. That's one thing. You could do something else, but then you could use some of the essential oils, but you won't be able to stay there with your eyes open because that's going to sting your eyes. So that's why I think salt would be the best.
Okay, I have to.
Yeah, because why I'm saying that? Because there are a lot of nasal sprays that are actually salty water or seawater to decongest your nasal passage, and it's simple as just water and salt.
I'm so happy.
Okay, so now you have in your handout what you do if you're alone. You can use a T-shirt for that. I find that it's less than ideal, but ideally if you are that sick that you cannot do a shower and you need someone to do constitutional hydrotherapy, you will need someone to be there, right?
Yeah.
So you don't need to use a T-shirt. So, but I just wanted to put it there. But I always prefer, if you can do a shower, do the shower because it's so much easier. Heat, cold, hot, cold, and you're much more refreshed. Now, mind you can do that morning and evening, and there's a difference. You always finish with cold water, with hot and cold showers, but only in the morning, because that is gonna just spring you up and wake you up. Don't do that in the evening.
No.
Finish with the warm water use. That's the difference. If you want to just get in the mood, you get, sleepy. If you do a lot of cold showers in the evening, you're gonna be up and about, and it might give you insomnia, right? Because I'm ready for action. No, it's time to just cool down.
Is it the same thing with the sauna then, eh?
Yes, exactly the same. So, if you want to do sauna, again, do it in the morning. Don't do it in the evening, right? If you want to do jacuzzi, that's different. You can do jacuzzi in the evening. But sauna, you have to finish with a cold shower. Because otherwise, all those toxins are going to go back right into your bloodstream. Your skin is it's very specialized in absorbing things. So I don't have to tell you, when you work with chemicals, for instance, with and I hope you don't have this in your house, but if you do, and you have to use it, use gloves. Do not touch the chemicals empty-handed, because those are going to enter, like something like bleach, for instance. They're going to get into your skin and quickly into your bloodstream, and they can poison you, even if you don't feel it. But you can start having rashes. You can start having it absorbs very quickly and gets into your bloodstream. Yeah, so don't touch them with bare hands. Just use gloves, right?
Wow, that's a lot.
And so I think that kind of concludes our sessions, right?
Wow. Thank you. Thank you.
Now, I don't know if you've been asking questions all throughout this workshop. I don't know if you have any questions.
Oh, we have something else.
Yeah.
Do you want the chair, Dr. Boldi?
Yeah, you want to
down?
Yeah, sit down.
Maybe we should proceed the word of prayer.
Just a
Proceed the word of prayer.
Yeah, oh, that would be nice.
Any questions?